Hey, Virginia. All right. It is 5 o'clock on a Friday. We have made it through another week, getting to the weekend, which means we're 1 week closer to defeating COVID-19. We don't know exactly how long that it's going to take, but we know that we are just a little bit closer to the light at the end of that tunnel. So let's remind ourselves, because it's a grind, day in and day out. We continue to feel the anxiety. We continue sometimes to be scared. But remember, there is hope. There's a definite end. And we're going to get through this. And we're going to get through this together. So say it with me. We're going to get through this. We're going to get through this together. One last time. We're going to get through this. We're going to get through this together. We're going to get through this together because we've gotten to this point. We know that we've got what it takes. We've just got to make sure that just because it's May and just because the summer's coming up, that we don't ignore the fact that this virus is still here, that it aggressively spreads, and to many parts of our population, that it can be deadly. Now, a lot of the chatter or any attempts at back and forth out there, it all tries to ignore the coronavirus or act like it's just passing. It is right here every day. But you know, it's not going to be here every day into the future. We just got to do what it takes until we get to that effective treatment, until we get to that vaccine. And that's going to happen, folks. It is going to happen. So stay strong. We're going to make it. We're going to continue to be good neighbors. I have faith in so many different ways, but I have faith that we're going to get this done. And part of the reason that I have faith in you is that you know the 10 rules to defeat COVID-19. Now, I've gone through a bunch of these at different times. I'm going to start selecting one each day to talk about. And today, that is going to be washing your hands and surfaces. Now that we are going to go from healthy at home to healthy at work, washing your hands multiple times a day, 20 seconds, no cheating, making sure that you are disinfecting surfaces and you are using a disinfectant that will kill this virus is really critical. I will tell you, healthy at work, one of the biggest challenges for facilities is this disinfectant is every surface of a facility that people can touch. It's a real challenge, and let's make sure that we continue to do it. I believe that the healthiest economy coming out of COVID-19 is going to be the one that can keep the virus contained while they successfully reopen. So if one group runs out, does things too aggressively, has to shut down again for a while, they're not going to come out in the best place. If one group has rules out there, but people don't follow them, people don't wash their hands, people don't disinfect surfaces, they cheat, they don't follow the rules, they have to shut down, they will not come out ahead. If we can do what we have done at being healthy at home and being healthy at work, it means we won't have to take a pause. We won't have to shut down again at any time. And if that happens, I'm telling you, regardless of where we are right now, we'll come out with one of the strongest state economies. And that is what our plan is designed to do. I told you I was only going to talk about one, but I'm going to talk about the other, which is apply for benefits. So some good news here. I told you there were 23,000 remaining claims from March. 11,191 were resolved yesterday. So we are significantly down on that number. And again, remember, some of these are duplicates. Some of them are claims that the employer says people don't qualify and are going to have to go to an adjudicator. But that has significantly whittled down those March claims. And to give you an idea of what this group's had to do in the historic numbers, we've now paid 690,000 claims. Those are all to different individuals for over $1.2 billion. So a lot of work, a lot of people working hard. Everybody out there that we haven't helped yet, our fault. It's not acceptable. I know you're in a tough position. We're going to work just as hard as we can to make sure that you are helped. Aside from these 10 rules, we have an 11th. Fill out your census. I'm going to have to figure out something new to motivate everybody. We'll look for that. But we have again fallen out of 13th place. We have let another state overtake us. This is really important as we look to rebuild, as we look for maybe future CARES Act money, as we look for what's going to help prop us up. How well we fill out this census is going to depend on how hard or how much advantage we may have in doing that. One small act you can do right now. So in addition to the 10 rules and filling out that census, we have asked people to fill up social media with really positive messages, positive statements, pictures, videos about truly living out our duties as members of the Commonwealth, duties as patriotic Americans in making the sacrifice and doing what it takes to defeat COVID-19. These are some of the hashtags we've used, and there's a new one, healthy at work. Folks, if we're going to do this, and we are going to continue to save lives, and we are going to keep our workplaces open, we got to do it really well. And this has been one thing that's helped us to be healthy at home. So we want to start seeing places of employment. You're getting ready. You're starting on Monday. You're moving around the office to distance people out. You're doing the cleaning. You're getting the masks. You're getting the hand sanitizer. Come on, fill up healthy at work. And I tell you what, if the public sees it, they will have confidence in your facility that you are doing what needs to be done to keep people safe. So businesses, employers, employees, if you're happy with your workplace, let's make sure that we make healthy at work trend here in Kentucky so we can show people that we can do this right. So let's see what we have on for today. Oh, so this is Willow's citation, which is one of our long-term care facilities. These are the hardworking folks in there wearing green for compassion, making sure that they are showing not only their resolve and knowing that we're going to get through this with the color of renewal, but also the color of compassion for those that are struggling or those that we have lost. All right, so Pikeville has turned their streets into a yearbook for their seniors. And we're seeing really special things out there to try to help make this lost moment a little more bearable, because we have a lot of lost moments. All of us, everybody has missed an important moment during this period. And for seniors in high school, I understand this could be particularly tough. Seniors in college too. This is a city, a school, doing something really special to try to help fill that void. Way to go, Pikeville. All right, so this is Lewis County, and we're seeing these all over the Commonwealth, some working with private vendors, some working for us, but developing drive-through sites to help us lift up our capacity and make sure we can hit the benchmarks we need. 145 tested during Lewis County's first day. Pretty special folks. Notice all the PPE that they have to protect themselves. All right. Clear Creek Elementary, just making sure that their kiddos know that they are missed and that there is a new school year ahead, that we are going to do our very best. And a lot of what we're doing right now is working to make sure we can have as normal of a school year this next year as possible. All right. I love that teamwork makes the dream work. This is somebody who's making masks in Murray to protect folks. I mean, when you think about some folks that I get don't want to wear one of these, look at what Corey Johnson is doing, knowing that the decision to wear one of these may be the difference if you're asymptomatic between someone else living and someone else dying. And given that nobody's going to take a test every day and know every day whether they have it or they don't, it's just one small thing I can do to live out my faith, that golden rule, how I can be a good neighbor, how I can be ethical in this time of the coronavirus. I want to thank Corey for making it a little bit easier for folks out there to make sure that people are safe in Murray. And by the way, whatever city, town, and county you live in, you're likely to be safer if people are wearing these. And your business is more likely not to have an outbreak and not to have to shut down. It all works together. All right. This is Corbin Health and Rehabilitation Center. Again, we're seeing this everywhere, every part of Kentucky. Don't let any chatter fool you. We are still more united than we've ever been. Not Democrats or Republicans, not liberals, moderates, or conservatives, just Americans versus the coronavirus. And here, most definitely Kentuckians versus the coronavirus. Just look around at night, see all those green lights, and know none of us are alone. We're all in this together. Now we've got a short video put together to thank folks that we haven't thanked enough. Oftentimes we're talking about our healthcare workers, but we are not talking about those that have kept our food supply going, including our grocery store workers.
Here's to the dedicated, the tireless, the strong, the ones who have kept us marching on. Thanks to the cooks, the cleaners, the baggers and stockers, the pharmacists and techs, the cashiers and clerks, the managers and drivers, for innovating and problem solving, for rising to the challenge. To every person working hard day in and day out, we are able to continue safely serving our communities because of you. Thank you.
All right, and we'll turn that down a little bit. Right before we get to the numbers, we have a special guest with us here today who we haven't been able to see for a while, except once or twice via Skype. So your Lieutenant Governor, Jacqueline Coleman.
Well, good evening, Team Kentucky, and thank you, Governor Beshear, and everyone in our administration who has worked so hard to keep Kentuckians safe and to keep us all informed. I'm here at the end of a week that's really important to me. It's the end of Teacher Appreciation Week and Nurses Appreciation Week. And I personally owe a debt of gratitude to the nurses who helped to bring my daughter Evelyn into this world exactly 3 months ago today. I'm also a teacher myself, and so when I began my profession in teaching, I knew I was joining the ranks of the best and brightest across Kentucky, and I owe a debt of gratitude to the teachers who inspired and believed in me, just like my colleagues inspire and believe in kids across Kentucky right now. The sacrifices of these two professions and their commitment to our communities has never been more evident than during this COVID-19 crisis. It's opened our eyes to the sacrifice that they make every day. And for too long, they have gone underappreciated and they've been undervalued. It is no coincidence that the vast majority of people who make up the nursing and education fields are women. And so with Mother's Day right around the corner, I want to pause and give thanks to all of the strong women across Kentucky. I'm an adoptive mom, I'm a stepmom, and I'm a biological mom. So I know that sometimes you're born into a family, and sometimes you make one for yourself. I also know that the next generation of Kentuckians is watching us, especially the young women, and that we must be an example for them. So as I return to the Capitol physically, I want to begin it with a really important message of gratitude to women who are serving on the front lines across Kentucky every single day. So thank you to our healthcare professionals. Thank you to our educators. And happy Mother's Day. And Virginia, I think a good way for us to practice sign language today would be learning how to say Happy Mother's Day. Okay, so Happy Mother's Day. Okay, one more time. Happy Mother's Day. Thank you. Thank you.
She beat me to it. So, Mom, Brittany, happy Mother's Day. I'm sorry Jacqueline said it first. I think you'll forgive me. One of you will probably forgive me. Today's, and they're both watching. Today's numbers are more in line with what we've been seeing. They continue to suggest to us that we have plateaued. We continue to have one problem in our data where we know we are not getting all of the negatives, all of the tests that have been done. We know that we have done significantly more tests than what our number is right now, and we're working on that. We're working on it to make sure that it is accurate, because I believe it will show that our rate and our mortality rates are lower than what it shows right now. Your numbers are only as good as your data, and we're working hard to make sure that we get that number right. We feel very confident in our number of positive cases, but the overall total cases we expect once we do an audit will go up, not total positive cases, but total number of tests will go up significantly. So today, we're reporting 176 new cases of COVID-19. That is out of a total number tested thus far of 86,428. Again, that's artificially low. We're working on that. Total number hospitalized, 1,696. Currently, 369. We believe that those numbers are pretty precise. Ever in the ICU, 723. Currently, 210. That number has kept creeping up over the last couple of weeks. We're going to have to watch it very carefully. But let's remember, it means there's 210 people in the ICU that we ought to be thinking about. It's called an intensive care unit for a reason. So let's make sure we keep those people in our thoughts and in our prayers. Total number of recovered. This is a good number, 2,266. That's about 36% of the overall positive cases. We are reporting a total number of cases to date in the Commonwealth of 6,288. That includes 19 probable and the rest lab confirmed. New cases by county: Jefferson 35, Warren 27, Fayette 14, Kenton 13, Logan 11, Boone 10, Shelby 9, Davis 6, Muhlenberg 6, Bullitt and Hardin 5 apiece, Butler, Campbell, and Edmondson 4, Breckenridge, Floyd, Grant, and Lewis 2, and 1 in Callaway, Carlisle, Christian, Clay, Graves, Jessamine, Laurel, Leslie, Lyon, Meade, Mercer, Nelson, Oldham, Rowan, and Russell. The other day, yesterday, for the first time in a while, I just read you a few of the new case demographics, and we hadn't done that for a while. But again, I was worried that people maybe, because when we look at the long-term care numbers, they're pretty shocking. But maybe they've forgotten that this could impact everybody. And we're seeing that in our cases every day. A 21-year-old female in Boone County are in the positive cases today. A 32-year-old male in Jefferson. A 26-year-old female in Jefferson. 31-year-old male in Fayette, a 28-year-old female in Jefferson, 26-year-old female in Shelby, a 20-year-old in Kenton County, a 15-year-old in Warren County, a 20-year-old in Logan County, a 1-year-old in Kenton County. It's a hard one to hear. A 20-year-old in Warren County, 20-year-old in Bullock County, 13-year-old in Hardin County, an 18-year-old in Boone County, an 8-year-old in Leslie County, a 16-year-old in Jefferson County, a 15-year-old in Jefferson County. So remember, just because we believe we can do healthy at work doesn't mean that this virus isn't out there, that it's not aggressive, and that anybody can get it. And it can be tough to get through for anybody. So let's make sure that we're taking care of each other. Let's make sure we know where our kids are. Let's make sure we're doing everything we can to protect one another. Today, we are reporting 4 new deaths. Now, this number is a lot lower than yesterday, which is good, but these are 4 individuals we've lost, and these are 4 families that need our support. So let's make sure, even though it's 4 this time, that we continue to light our houses up green, ring our bells at 10 a.m., These are families that are counting on us, and I know that we are going to make sure that we honor them the same way we've honored everybody else. They include a 90-year-old female from Edmondson, a 90-year-old female from Hopkins, a 69-year-old male in Jefferson, and a 75-year-old male in Bullitt. And they bring our total number of deaths to 298. That's now almost 300 Kentuckians that we have lost. And while that number is so much lower than any model that was out there, while that number is where it is because of the hard work of each and every Kentuckian making the right decision, none of us want to lose 298 Kentuckians. So let's make sure that every day we're doing what it takes to make sure we don't lose another 298 Kentuckians. Every other family out there is counting on us, and each of these families would tell us that they want us and need us to do what it takes so that there is not more loss. Today we're going to recognize one of those we've lost, Charlene Parker Boyd. Today we're honoring Charlene, who we lost to COVID-19. She was just 57 years old. She's from Muhlenberg County. She was loved by her children, grandchildren, and her entire family. Her sister Jackie said, I dare not say that she lost her battle to COVID. I say that God called and she answered. I never saw her mad. She was such a sweet, cheerful spirit. You hear that and you know why we light our houses up green, right? The color of renewal, knowing that her spirit is simply leaving the vessel that is her body and going to a better place. Jackie called the hospital when Charlene got sick to make sure her sister knew her family loved her and was checking on her. That was special. To Jackie and all of Charlene's family, I'm so sorry for this loss and the fact that you won't be able to mourn the same way that we have in the past. This is why we keep fighting. We care about you. I know your whole community cares about you, and we're with you. Even in this difficult, anxious, and lonely time, we are with you. When we look at the breakdown of cases by race, 74.33% white, 13.74% black or African American, 6.34% Asian, 5.41% multiracial, 87.5% non-Hispanic, 12.5% Hispanic. On deaths, 78.41% white, 18.18% black or African American, 2.27% Asian, 1.14% multiracial, and then on ethnicity, 98% non-Hispanic and 2% Hispanic. Let's look at long-term care facilities. Secretary Freelander is going to talk about this in a minute, but just to go over the numbers, yesterday, our numbers were actually had some duplicates in them. So this number is actually down one on residents from yesterday. That's a good sign. It means that between yesterday and today, we didn't have a significant increase. On staff, we have 3 additional. On deaths, we have 9 additional. And remember, this is one that we have to attribute looking back at deaths that we had already announced. These are tough numbers. It shows that this virus is still very real. So with that, I'm going to turn it over to Secretary Freelander, who is going to go over what we believe is a very strong and a very aggressive testing plan and a care plan to help with these facilities.
Thank you, Governor. First, I want to say one of the best things we've done is right at the beginning, very soon after March 6th, I believe it was March 10th, we stopped all visitors into our long-term care facilities. The governor said earlier, we know we've saved lives. We know we've saved lives here. So we've had an aggressive policy. You all have heard me talk a little bit about some of the things we've done in terms of our reimbursement long-term care facilities, in terms of our support for long-term care facilities through this time when we have reached out to facilities. We've given what we think is our best guidance. We've given what we think is the best support we can give. But we ended up in a place where a month ago, We were still very worried about how much testing could we do. We were still very worried about, was there enough PPE, something that we've all learned about personal protective equipment. And frankly, we had a long way to go. But there is good news here. We have been much more aggressive about supplying the nursing facilities with personal protective equipment. They have registered through the WEB EOC, the Emergency Operations Center, and now, as they need personal protective equipment, we can supply it. We have elevated their needs so that we can make sure that they can get personal protective equipment as they need it. Just this week, the federal government has stepped in to help us, and they have started delivering personal protective equipment to nursing facilities across Kentucky to make sure they have a 14-day supply. So I give that as an example of we are improving and we have worked to improve. Now, on to testing. Again, in the beginning we were saying you have to have symptoms. We were making our testing quite limited. And that even applied to our long-term care facilities. Now what we're saying is we are working on a plan. And we have a plan in place where we are going to test facilities all across the Commonwealth, all of our facilities. We've tested several. We think we've tested about 10% of the residents, and we are going to get to 100%. And so the hospital infection team, local health departments, hospitals, and particularly Norton Healthcare, who's been a fantastic partner with us, we have worked to come up with a plan to test facilities, and we're doing that in a way that we have stratified those that we need to test first. We have things like the rate of increase in positive tests. We have things like their location in a county that may have high rates of COVID-19. We're looking at things like, can they cohort their residents? There are all sorts of, there are 8 reasons and things that we stratify. So we test those facilities based on that stratification. So we've tested about a third of those that we have in our highest category, and we are going to continue to roll that out across. And we do that in 3 ways. Some facilities, we just ship them the tests. Our partner at Gravity Labs is helping us supply those testing kits, and they can do all the getting of the samples themselves. Some facilities need some assistance, and so we work with our local partners, like the local health department and the local hospitals, so that those facilities will be able to get the testing, to get the specimens. And then some facilities will need all the help that we can give them, and those facilities, we've asked Norton Healthcare to go out and collect the samples from them. So we have 3 different tiers of facilities, 3 different ways that we look at collecting samples. And then those tests are of no charge to the facility, of no charge to the residents, of no charge to the staff, so that folks can feel like they can and should get tested. And we've contacted facilities, we call them. Some facilities have volunteered to step up to help us roll this out so that we can work out and learn as we try to test these facilities. But we require that they have a plan. I think we talked earlier about the importance of you need to know what you're going to get into. You need to have a plan for what happens if you get your tests back and you have some positives or a lot of positives or none. So there has to be a plan in place before we can go out and test. And we're working with the facilities on that. We're providing them guidance. We are also making sure, so this is the pre-planning piece. I talked about the stratification piece. We are going to test all the facilities. Those are the nursing facilities. There are some other facilities like the assisted living facilities. When they start to have trouble, we're going to bring them up to the top of the list. So it's more than just those 286 skilled nursing facilities that we are going to test. And like I say, all residents and staff, Norton Healthcare has been a fantastic partner. Gravity Labs has been a fantastic partner. And we hope to get this done in as quick a time as possible. We think it will take us a couple of months to get through all 286 to 300, but we know that we're going to be able to do it. If it wasn't for this partnership, we wouldn't be able to, but we're excited to be able to offer this and some assurance to the folks in long-term care. Now, I know Mother's Day is coming up, and we have worked with facilities, over 100. I think I talked about our how we would fund with some virtual ways to visit through some of the funding that we have at the cabinet. We've done that. Over 100 facilities have taken advantage of that. And we'd like to ask our facilities, you can visit through the windows, right? Don't open the windows, don't pass anything back and forth, but you can visit that way. And we've learned some facilities, state facilities, have put up some large plexiglass pieces so people can visit across fences, outside, if hopefully it's a beautiful day, and we encourage that. We know that you miss meeting with your loved ones. That's a very big sacrifice that you've made, but it's important sacrifice. And as the governor says, you have saved lives. Thank you.
So it is a very aggressive strategy where we are now going to be very targeted in making sure that we know the situation in each of the facilities, especially for the most vulnerable, and are able to take some quick action. All right, so today we have guidance going up, I believe, for every single industry or area, opening up all the way through May the 20th. That is retail. We were able to add funerals as well on the same date as houses of worship, and to get those guidance up so that there will be some more opportunity to be able to have some more family at those funerals. I know how important that is, and we got some very good buy-in on how we believe we can do it as safely as possible. It includes government guidance as well, though we'll still be working on things like museums and libraries next. And one of the things that it includes are also houses of worship. So today we're announcing that we're posting our final requirements for the following groups that can reopen Monday: manufacturing and distribution, construction, vehicle or vessel dealership, office-based businesses, horse racing without fans, pet grooming and boarding, and photography. In addition, we have retail, houses of worship, funeral services, and state government and offices and agencies up. These requirements have been a very good collaboration with our Healthy at Work team and the Kentucky County Judges Association, Kentucky League of Cities, KCO, Kentucky Chamber of Commerce, Kentucky Association of Manufacturers, Kentucky Council of Churches, Kentucky Baptist Convention, Kentucky Retail Federation, Funeral Directors Association of Kentucky, and dozens of clergy or other faith leaders that are out there. They are all going to be posted online. There are going to be a lot of thresholds to meet. That's just to make it safe. And I believe a lot of the leaders in these areas are already saying that not everybody should go back, start back on the day that they can. Just because you can doesn't mean that you should. And I want to mention our houses of worship real quick. We have that guidance out. That's perhaps one of the best collaborations we've had to date. We've partnered with so many different groups. Two that just wanted to point out was the Kentucky Council on Churches and the Kentucky Baptist Convention, which reviewed the guidance that we have, provided comments, and we all collectively feel very good, both faith leaders that are representing different houses of worship and our public health officials, and being able to really collaboratively come to an agreement on what the requirements should be. And I want to really credit these groups. They wanted there to be requirements. They don't want an atmosphere that is not safe. They want to ensure that it's safe. So we appreciate everybody out there. And remember, listen to your faith leader. If they tell you that it's not, they're not ready and that they don't think that it's safe, then you should wait. Being able to clean the right way an entire facility can be very difficult. Making sure we've got the education out there about how we can't do some things the same way, also pretty difficult. Marking out where people can and can't sit to have 6 feet in every direction, again, pretty difficult. So please, let's not pressure. If our organizations, if our houses of worship won't be ready or have made a choice to do virtual or drive-in services for a while longer, let's support them in doing what they believe is safest, and that should go with everything else. So we announced restaurants the other day. If one restaurant doesn't think that they're ready, we shouldn't be calling them and pressuring them to open. They're just trying to make it as safe as they can. Same with retail. Same with everything else. We got to give people the space and the time to make sure that they can do it and do it well. Again, I'm very pleased at how it came together, and we're continuing to work on guidance for restaurants, which will come later, but in plenty of time, hair salons and barber shops, cosmetology businesses, nail salons, tanning, massage therapy, and tattoo parlors. We hope to have guidance put together for their comments next week. Again, we've worked to be as collaborative as we can with as fast as we have to move. So testing. If we're going to be healthy at work, we have to be doing significant testing all across the Commonwealth. And you saw Lewis County up there. That's really positive. And I mean, look, more testing, and there's even more than this, but more testing this week than we have ever seen. Now, we got to get better at the reporting of that testing. Feel very good we're getting our numbers on positive cases, but in all the tests that are going to be done here, and we're going to be adding to this, I feel like we can get to the levels that we need to. In fact, we have the capacity to exceed those levels. A report from our Kroger sites from this week, as of 4 o'clock throughout the week, they've done over 6,028 tests in those 4 locations, and I know that will grow. And remember, next week on the Kroger sites, if you can put up the Kroger sign up, Louisville, Lexington, Corbin, and E-Town, and there are spots open just about every day in every area. Now, Louisville is fully booked Monday, and E-Town is fully booked Tuesday. But when you look at Louisville, which is our largest city, and we need to have more testing, about 200 spots open next Tuesday, about 300 spots open next Wednesday, and about 350 spots open next Thursday, and a full 400 next Friday. Those are spots we need to fill. Go online, which is right there, and make sure you sign up. Lexington, about 25 on Monday, about 200 on Tuesday, 300 on Wednesday, almost 400 on Thursday, and the full 400 plus on Friday. Corbin, we need a lot more signups. This is an area where we haven't had a lot of testing, and we need to make sure that we know the spread of this in the area. In Corbin, we need 300 more on Tuesday. We need 350 more on Wednesday. And we need 400 on Thursday, and that's the last day in Corbin. Make sure we get these signups. E-Town's done really well Tuesday, got about 50 more Wednesday, and about 300 more on Thursday. I believe that those are going to be signed up. It's not just having the capacity to test, it's making sure people get tested, knowing week to week, month to month, for a certain percentage of the population where this virus is, and being able to contact trace helps us be healthy at work. If people won't go in and get the tests, then we can't track where we are, and it makes it less likely that we can successfully get through healthy at work. You put up the Battelle slide. Want to remind especially our healthcare providers that we have this Battelle machinery, which helps us clean N95 masks. We have significant additional capacity. We want people to sign up for our program there. It allows that cleaning for a mask to be used up to 20 times. So that provides significant additional use of PPE. Right now, Northern Kentucky's doing a very good job of taking advantage of this program. This can be dentists, it can be solo practitioners, it can be large systems, but we need to take advantage of the tools that we have. And finally, just a good update on one of our meat processing plants. Purdue has now gotten through the testing of all 1,000 plus individuals. at, I think it's the Ohio County facility. They're working directly with public health. They are taking steps inside the plant. We believe those conversations are at a positive place now. We'll await to see the results, but we're getting a lot better cooperation there. We want that to continue. We need to keep our food supply secure, but we can't ever ask someone to go into what we know or what we think is a dangerous situation. These are good steps that ought to give people confidence. And as we talked about the other day with new testing partners, the Solaris First Care, along with Blue Water, we now have the ability, when we have an outbreak, or we think we do, in any type of facility anywhere, for that employer to be able to test everybody in the facility. We don't have to make excuses anymore. We're not facing the same type of shortages. So let's make sure as we go back to being healthy at work that we're doing everything we can to take care of those around us. And if you're going back to being healthy at work, sign up for a test. We all want to know if we are asymptomatic, if we might be spreading this to other people, and none of us want to live with that. None of us want to go into an environment where we could be spreading things. So sign up to make sure you're protecting those around you. And perhaps the update that those that are gathered here today want to hear the most, we are not going to have an update on Sunday, which is Mother's Day, because every day my wife Brittany is home with the kids from at the very least about 3:30 to about 6:30, and I think on Mother's Day I ought to be there. Also, our numbers come in really low on Sundays, so we'll go tomorrow, and then we'll be back on Monday. So let's move into questions. Today we have 4 journalists. We got Karen Czar, Phil Pendleton, Mike Valente, and Morgan Watkins, and then some questions that have been sent in. Let's start in reverse order today with Morgan.
For nursing homes, since such a high number of staff members have tested positive for the coronavirus, how is the state going to help them, in terms of staff? Is there any help you guys can provide in terms of staffing, et cetera?
The question is, with nursing homes and having such a high rate of staff, what type of help is the state providing? First, that's one of the reasons they need the plan. And second, we have helped in a number of different ways from, remember, the volunteers, that Dr. Stack's volunteer army of nursing students and med students that have helped in many places. We actually have the National Guard assisting at a facility in northern Kentucky right now. And we have hospital partners from across the state, like Norton and others, that have stepped up and have been willing to come in and help provide that additional assistance. Did I miss anything? All right. Eric Freelander is going to correct everything I just said.
I'll be like Dr. Stack. You did an excellent job.
But
there are a couple of other things that we've been working on. So we do, when we work with Norton, they have sent in some strike teams. Those are nurses. We call them strike teams, but they're nurses, they're CNAs, they're folks that go into the facilities and help to hold them together. We've had to do that a couple of times. We've also been working, our long-term care task force has been working with the facilities, has been working with some of our education partners, as well as some of our colleges and universities to try to set up a way that those folks who are graduating and particularly in healthcare, will be able to match to some facilities to make sure that those folks and the facilities' needs are matched together. That's something that we are working on right now and hope to have that up and running by next week.
I got most of it right. Kristen Shanahan from WDRB. Many restaurants operate on slim margins. Are we concerned that some will not be able to survive at 33% capacity? Well, certainly what we're able to do in May, that earlier date, is better than not being able to operate. Our hope is that plus outside seating plus continued takeout. Folks, that's still the safest, right? I mean, all of these things that we're doing have some level of risk, though I trust our operators are going to make it as safe as they can. But doing all of that, we hope, gives everybody a real shot at getting started. Now, we're going to start at 33% capacity. It doesn't mean we can't increase that capacity as we see the level of compliance, as we get through a couple of weeks, and we see where all of this is. None of these are lines in the sand that are going to continue. We're being flexible based on the virus, based on feedback. Also, will we give guidance on how churches can open? It's online right now. Again, a full collaboration with at least the associations we were working with, fully bought in. We feel very good about where that is because we've got to have those faith leaders not just agreeable, which they are, but exactly what we've seen. Having the input and believing that the steps are necessary and good and will make it safer. Mike?
We've heard from some daycare owners who were hoping that you could elaborate on your comments yesterday. I think there are some, particularly those that have larger facilities, that are worried they may not be able to pay the bills. So say a center serves 110 kids. How many kids would you envision being able to be kept in that facility? And
Right.
also, will places like the Y still be able to serve kids of healthcare workers?
Yeah. Question is on child care, which admittedly we are still working on. And from some facilities are all different, right? There may be small facilities with only a couple of rooms, and from a capacity standpoint, that may be a challenge. Bigger facilities may depend on their ability to keep children separate, right, and not interacting. So if we look to set a certain capacity rate, it could be that some facilities can run multiple programs. They're just going to have to be very careful. What we're going to have to figure out, and we don't have it figured out yet, and we want input. I think we've been pretty transparent about trying to find the way, is to lessen the multiplication of contacts that we showed the other day. And part of that is not having 30 kids, in one area all interacting. So our goal, certainly long before June, is to get to a point where we believe that we've got at least the safest way to move forward. And there may also be some types of summer camps that could qualify for that. We're not trying to set a specific type of business. We're trying to set the type of parameters that we believe can be healthy. And we've seen some of those parameters in other states, which we're looking at right now. A large number of states did what we did for essential workers, and we'll keep that open for that group. It's better if we don't cross-pollinate the food workers and the first responders and the healthcare workers' kids with others. I know that sounds like a strange phrase. We're talking about kids. I like my kids, but again, this virus doesn't care, and it's just based on a number of contacts that can ultimately lead to the spread. We announced the reopening of campgrounds on June 11th. Will we be with you urging Kentuckians to travel in-state this summer? Kind of. I don't want you to travel at all if you do travel in-state. What about lodges at state parks? We're working on that right now. We believe that there will be some opportunities there. We have to reserve some of them in case we do have a spike. It's one area that we know we can house people that are ready to go. And so we're making sure that we can get the right type of plan together that provides opportunities for people that we believe we can monitor and keep safe, while at the same time having that overflow capacity as we reduce our beds available by allowing elective procedures as we move forward. Government plans for public libraries, we're working on that right now. We hope to have news on that soon. Phil?
Can you tell us where the unemployment trust fund is as far as the amount of money that's in it? And is there any danger that might be running out of money, or is there a date that it might run out of money?
So the question is on the unemployment trust fund. At the current rate, end of spring or into the summer, we're going to have to look at options. We feel pretty good about the dollars that are in it, about making it to those points. We'll see exactly how much Healthy at Work picks up our economy, how many people go back to work, but knowing that we've just got to get through the period of time to defeat this virus. We're going to do whatever it takes to ensure that there are dollars in that, including borrowing, which was done during the Great Recession. Surely we would do the same during COVID-19, a worldwide health pandemic. Can we get another update on total number of claims? I did that. Total number of unemployment insurance claims. Where does the I answered all those right there. Why is it important for people to be tested? All right, this is critically important. When we are just healthy at home, you've reduced your contacts so much that we don't typically have to do the contact tracing, and we don't have people out in a way to where if you have it, you're likely to spread it to as many people. But going back to healthy at work is very different. So we need to know and to be able to catch people when they're asymptomatic, and we need to know when somebody comes into work sick or calls into work sick that we can get them tested right away. Because the way our world is going to work going forward, till there's a vaccine or an effective treatment, is somebody is going to get sick, they're going to get tested, they're going to find out they have the coronavirus. Our team and our local health departments are going to get into action, get to work. They're going to be contact tracing, and we're all, or some of us are going to get a call saying we've been in contact with somebody who's tested positive, and we're going to need to self-quarantine for a period of time. That's the way, and that's the president's plan. That's everybody's plan. That's the way we get back to being healthy at work. So the only way that we keep the spread down, knowing that this virus is still spreading through contacts, is to make sure we have significant testing, and then the other piece. Now, we believe that right now we're moving up in capacity. We could do almost 50,000 tests per week among 3 manufacturers, and that is significantly more than we've ever had. It gives us a chance to have 200,000 tests a month, which is a really big number that I hope one day we can achieve. The White House wants us to have about 88,000. So think about what the opportunities are there. I'm really encouraged. It's hard to be encouraged during all this. I'm really encouraged by how our testing is ramping up. Deployment of those tests and making sure people get tested is our new challenge. But that's a great challenge to have compared to the challenges of the past and not being able to get them and not being able to get PPE. Karen.
Governor, I know you said that you're obviously monitoring other states who have moved a little bit quicker than us to see what their trends are. Is there anything you're finding that's causing you pause moving forward on dates or possibly moving earlier by what's happening elsewhere?
Question is on monitoring other states. It's still really early. No one's really been 2 weeks into a whole lot. You know, you see different numbers. Tennessee had 4 days. Texas had 3 days. Georgia had at least a day that are all worrisome, but I don't want to read too much into that. We had a day the other week, this week, when we tested Green River, that without context would have looked very different. So we need a little bit of time to see those trends. We also need to see how opening up something specific impacts the overall numbers. Because at this point going forward, we got to be surgical. We've got to realize as we open up something, is it one specific area that can potentially spread things more? You know, the New York Times had a really interesting graph on what they thought were areas that the spread could happen the most in. There are areas that you're there in the longest duration. In other words, right now, if you're in a grocery store and you're in and out and you're wearing a mask, you're probably at really low risk. Even if somebody else there might have it, you're not there long and you're not in contact with that many people. But as we look at other things where you are there longer and there is more contact, that could potentially be more problematic. So there is at least a chance that we can be surgical. If we start to have, I'd say, a mini surge, if we have a big surge, we got to take major action, that we can potentially just look at the areas that are causing it and look at pauses there. Morgan?
Yesterday, you really stressed that you're seeing cases among younger people and
Yeah.
people of all ages. Today, there was some sad news announced. Louisiana governor said a 10-year-old died about the coronavirus there. Officials in New York and New Jersey also announced this week a couple of children under 10 who died. And so I was just interested in hearing from you just more about like what parents can do to try to protect their kids and that
Right.
kind of thing.
Generally, the coronavirus has been deadly and lethal in our senior population, especially those that have some significant pre-existing conditions. If there's been a blessing in this, it's that kids have been relatively spared, but we are starting to see not just more cases. We didn't test kids for a long time, so it's hard to say that there are more cases, but we are starting to see some concerns. I hadn't heard about Louisiana, about a 10-year-old. My son's 10. It hurts. But we are seeing something they believe is COVID related, though doesn't present the same way in New York. And candidly, that's terrifying to us parents. But what we've got to do is continue to treat it like it's real. That knowing that our kids could get it and potentially it could harm them, but they could also spread it, meaning your kids could unintentionally harm somebody else, which none of us want. So let's make sure that they're following the rules, that they're still healthy at home, that we talk about social distancing, which is really hard with kids, even though they want to try. We get the hand washing. Oh man, trying to get my kids to stop touching their face. And that we have as much hand sanitizer that we slather their hands with as we can. But remember, the most likely way that your kids being healthy at home right now get it is from you. It's from me. One of the reasons I wear a mask, one of the reasons I try to follow the rules and limit my contacts. So let's realize that there is always a danger out there with our young people and even our kiddos. Any updates on Kentucky Kingdom reopening? I believe that proposal's with Dr. Stack. Right now, we're not seeing gatherings of 50 or more until at least July, though depending on how summer impacts this virus, that could change, but haven't had a full review of that proposal. And then there's some legislation potentially going through in D.C. How would it impact contact tracing? I need to look at that legislation, and we'll get an answer from our tracers. Mike?
I know that testing has been expanded at Green River, but inmates are still describing some disturbing conditions there. According to one inmate's wife, the food workers have gone on strike, so they've been only eating peanut butter and jelly sandwiches. They're also worried about people who tested negative being exposed, and also a lack of cleaning. Is there a possibility you can get an outside agency to come in and deep clean?
So what we've got right now is a question on Green River and concerns about family members of folks that are incarcerated there. And I get family members being worried. That's a lot of positive cases. What I will say is the reconfiguration of that population is one of the biggest steps that we've seen at any prison across the country. It's very difficult to do in a prison, but not just having two groups, those that have tested positive and those that have tested negative, but having four groups that we start with, those that are positive, those that are negative but have had exposure are being moved to a different area. Those that are medically fragile but have tested negative are going to even another area. And then those that are negative that haven't had exposure to another. We've got some new procedures there about putting eyes on each individual and then making sure that we can actually look at and assess their health. And we've got a lot more oversight there. There was a decision made by an individual out there that actually released somebody whose test was pending. And they are now back there, but that is not an okay decision. That can't be made, and that'll be dealt with. But we are watching it very closely. We're going to make sure that good decisions are made going forward and do everything within the confines of that facility to try to protect those inside. Admittedly, it's harder in a facility like that where you also have to keep order. That doesn't mean we're not taking really significant steps. Phil?
Of course, we continue to get people calling us and emailing us about unemployment questions, but we have a sort of an interesting situation. A woman, I'm not sure where she lives, I don't even have her name, but apparently she has very limited telephone capabilities, like an old flip phone, and she has no computer, can't go to the public library because obviously the libraries are closed. If someone is in that situation where the communication is the trouble, what can they do to get through?
Right, that's a challenging situation. This is an individual who's filed for unemployment who has very limited communication, no computer, older phone. Those may be ones where we need partners like you in the media or local partners, county judges, state representatives, others that they might know to forward directly to us. Even with all the means of communication out there, sometimes we still need help. We still need those forwarded. names that media and others have sent to us have actually helped us to make sure that we can reach some individuals where there might be some more challenging circumstances or there might be some confusion. And it's been on both the filer's side and sometimes on our side, but it helps us. So anybody you can send our way and anybody that in other means is sent to us, we're working our hardest at processing them. But it does point out that it's everything in this coronavirus, that those that have the least have the most difficulty getting the help they need, and that could be in healthcare, it could be in testing, it can be in benefits, and we're working our hardest to try to make up for what's typically been inequalities that have existed for a long time. All right, Karen.
Governor, as more people go out, is there an age that you feel is too young that you would recommend wearing a mask?
Certainly no one under 2 should be wearing a mask. That's guidance that's out there. That's CDC guidance. Any of our kids that have any medical conditions that would make wearing a mask unsafe shouldn't be wearing a mask. And then we ought to make sure that any mask that our kids are wearing or that we're wearing, we can still breathe. I mean, what this is a barrier really for our coughs and for our sneezes. But we don't want this to make anybody unhealthy based on any conditions that they have. But again, I'm going to do my daily plead for people out there to wear a mask. I know some people think that they shouldn't have to or their rights as a citizen. I hear you. But this may be the difference between someone else living and dying. So if you're asymptomatic, and a whole lot of people are, and you refuse to wear this, choose not to wear it for whatever reason, and you cough, and somebody else gets the coronavirus and their body can't handle it. Sure, you didn't mean to, but you could have done something to stop it. Don't you think if we're passing our test of humanity, if we are good neighbors, if we're living out our faith, that we're not called to do something, as small as this? And yes, it's uncomfortable, but dealing with the coronavirus is uncomfortable. Oftentimes, the most important things you can do to help other people are uncomfortable. The tests of faith are never easy. They're always challenging. And this is just one that if everybody will do it, will help other people out there. I'll very quickly do one more if anybody has one.
As some businesses are able to start reopening next week, do they have to get individual approval from the state? And is there any, if they don't, then is there any way, how is the state going to make sure that as businesses reopen, they're actually following the rules?
So individual businesses do not have to get approval from the state. They do have to follow the specific guidance that is put up on the website and the general guidance. And those are the rules that are ultimately enforced. Local health departments will be using them. Labor Cabinet will be using them, and others. Anybody else? All right. Folks, keep it up. All right, it's Friday. The weekend's coming. Enjoy it. Enjoy being with your family. Enjoy getting outside. But remember, just because it's turned May and the weather's been beautiful doesn't mean this virus is gone. We read you some of the ages that are out there. We need you stronger now, willing to follow this guidance more than ever. Because remember, when we're going back to work, we're doing it in the middle of a national and an international health pandemic. We've never dealt with something like this before. We certainly never reopened the economy while it's still out there. So we need you committed, and we need you strong. And so tonight, I think we have an ending. So we want you to enjoy it. And, this is the University of Kentucky Choir. I think everybody will really enjoy this one. Again, it's being creative, being able to share your talents even in this time. We'll see you tomorrow at 5, and then we're going to take Mother's Day off on Sunday. Happy early Mother's Day. Happy Nurses Day was earlier, and week. Happy Teachers Appreciation Week. Thank you to all Kentuckians.
As I went down in the river to pray, studying about that good old way, and who shall wear the starry crown, good Lord, show let's go down, come on down. Oh, sisters, let's go down, down in the river to pray. As I went down in the river to pray, studying about that good old way, and who shall wear the starry crown? Good Lord, show me the way. Oh, brothers, let's go down, let's go down, come on down. Oh, brothers, let's go down, down in the river to pray. As I went down in the river to pray, studying about that good old way, and who shall wear the starry crown? Good Lord, show me the way. Oh, mothers, let's go down, let's go down, come on down. Oh, mothers, let's go down, down in the river to pray. As I went down in the river to pray, studying about that good old way, and who shall wear the starry crown? Good Lord, show me the way. Oh, fathers, let's go down, let's go down, come on down. Oh, fathers, let's go down, down in the river to pray. As I went down in the river to pray, studying about that good old way, and who shall wear the starry crown? Good Lord, show me the way. Oh, sinners, let's go down, let's go down, come on down. Oh, sinners, let's go down, down in the river to pray. As I went down in the river to pray, studying about that good old way, and who shall wear the star